Hello, and welcome to Therapy Playground. I'm Melissa.
And I'm Julieanne.
Today, we're going to be talking about jaw weakness and how it affects speech and language, and how you can tell if your child may have jaw weakness. Julieanne, would you please tell us what jaw weakness is?
Well, jaw weakness is caused by weakness in the jaw muscles. You have your masseter muscle here, and then you have another muscle up here. And these two, they help move your jaw up and down. And when you have jaw weakness, it's just because you have some weakness in your muscle. It's just like having any weakness in any other muscle in your body. You can exercise it to get it stronger.
Great example, Julieanne. Now, please tell us how this affects speech and language.
Well, when your child has jaw weakness, of course, their jaw isn't strong. So the things that they need to do for speech and feeding, they're not able to do because their jaw isn't strong enough to do it. For instance, with feeding, the most important thing for your jaw to do is to chew up and down. And if your jaw is weak, then the child isn't going to be able to do that chewing motion like they're supposed to.
Yes.
So we'll do some exercises to strengthen that. Jaw weakness can also cause jaw instability, and what that is since the muscles are so weak, the child's not able to stabilize the jaw. So you'll see it moving around, when they're trying to chew. Instead of chewing up and down, you may see a lateral motion where the jaw is just moving back and forth. There's a child that I see now, when I use a chewing tube with her, she can chew up and down twice on it, but after that, her jaw just goes back and forth and back and forth. There's no up and down motion. So her jaw is really, really weak. So as far as feeding, she has difficulty doing that grading motion from high grading to low grading to chew up and down. And that's caused by muscle weakness. For speech, it can affect speech in many ways. One example is the R sound. And that's a sound that we as speech, it's very hard, and we see a lot of kids that have trouble making that
Right.
Some kids, it may not be placement, it may be jaw weakness, because your jaw needs to be stable in order to make that sound. Because if you think about it, when you make that sound, your tongue is back and it's being stabilized by your jaw, and that's what's keeping it in place. If your jaw's not stable, how is it going to be able to stabilize the tongue to make that sound? Another example is when children are a lot younger. We see a lot of infant-toddler kids from 1 to 3, and I have given many evaluations where the kid is trying to talk, and as a speech therapist, what they're trying to say. But if you close your eyes, is that kid really saying that? I mean, can you understand what they're saying? No. And if you can't understand, then why give them credit? Because they're not actually saying the word, and they have good intentions. But a lot of that problem is because of jaw instability and jaw weakness. You have a lot of kids that talk like this, and they don't move their mouth. And if you can't move your mouth, then you're not making those sounds. You're not getting your lips together to make the buh, puh, and mus sounds. Your jaw isn't moving enough to get those sounds out clearly, and your tongue isn't moving enough. So it can really cause speech to be unclear and mumbled sounding, and it can also cause the child to not be able to say certain sounds.
Very true.
So jaw strength is very, very important when it comes to speech and feeding.
I'm glad you said something about feeding. I do see a child, or many children, when I'm evaluating for feeding, and their primary problem is that they are not able to chew food. So you would notice that they like to eat more puree consistency, softer foods, because they're not able to chew the crunchy foods or even like meltables. They're not able to really tolerate that. And sometimes when parents are giving them these consistencies, then they're noticing that their children are either gagging or choking or even throwing it back up.
And then it could be, what is caused by jaw weakness can be misconstrued. The parent may think, oh, my child's just really picky. They only like certain things, very finicky. Well, that's not it. they're having trouble chewing those foods,
Right.
so they learn to stay away from those foods. They're not going to like those
Avoid it.
Yeah, they're not going to like meats,
Yes.
they're not going to like, soft salads. They're going to want those things that are easily meltable, that are pureed, especially if they're attempting to eat these foods
Yes.
and then they're not chewing them properly and they go to swallow and they can't, and they start gagging or they get choked. Well, then they have an aversion to these foods because what happened last time they tried to eat them? They gagged, they choked.
Or they threw up.
Exactly.
It's not good.
So they had to stay away from them. But yeah, so that's, the importance of jaw strength.
I never knew. Good job. Okay, so can you kind of tell us how parents can look out and see, when they're working with their child or listening to their child or, even at dinner time with their children, what they should look for and how they can tell that their child has maybe some jaw weakness?
Some things to look for is when your child's babbling, look at their jaw. Is it moving, or is it in one position the whole time? You can hold your hand underneath their jaw like this, and if they're talking and their jaw's not moving up and down like mine is, if you're able to keep your hand in one place, if you're able to keep your hand in one place, then obviously their jaw isn't moving like it should. That it's just, it's not moving, it's not doing that grating motion. Some kids have an open jaw posture where they're like, yes, exactly, just like that. Where, their jaw is just, very weak. They can't even hold it up to close it. There are some children with a slight open mouth posture. They have a higher jaw placement where their jaw is up further instead of down, but they'll have a slight open mouth. So it's not as visible as the drop jaw posture, but it's still slightly open and just relaxed. And when your child is eating, look at how they're chewing. Are they putting all the food in the front of their mouth and chewing it in more of a suckle motion? Like, is it all in the front, or are they using their jaw to chew, actually? And how many times do they chew before they actually try to move the food and swallow it? I saw a little girl the other day, and I told Mom to work on some jaw strengthening exercises. I told her to give her some, chewy candies, things like that to help strengthen her jaw. And Mom had a great idea of putting gummy bears in the freezer, so they're even more hard to chew. Well, Mom gave her one that wasn't even hadn't even been in the freezer, and the girl chewed it twice and swallowed it. She didn't even chew it all the way, and that's how you can tell jaw weakness right there.
And that's a very dangerous thing to do, because she could have choked, could have gagged, thrown it up, all these things that are very dangerous for children to do.
Yeah, so just if you're a parent, look out for these signs. Look out for their ability to chew foods adequately. If your child is staying away from soft foods or staying away from hard foods, it may be that they're not able to chew them. If they're not eating meats and things like that, they're probably having difficulty chewing them. So they may stick to softer foods like hot dogs and chicken nuggets, or purees like mashed potatoes and things like that.
That's wonderful information, Julieanne. Well, thank you for joining us today. I hope you've learned something, and I hope you will go and check out your children and see if they're chewing okay and their jaw stability is okay. Thank you.
Thanks. Bye.
Bye.